Well, if you're having issues with your pets, here's your chance to talk to a vet for free.
That's right. Sandi Sawchuck from the UW School of Veterinary Medicine is here. The number to call is 270-9933. Nice to see you, Sandi.
Nice to be here.
Phones are jammed as always, so let's get right to them. And we'll start with Alice. Hi, Alice. What's your question? Alice, go ahead.
We have a 2.5-year-old Cocker Spaniel, and she loves Kleenexes. If you lay one down, she's got it, and she eats it.
She eats Kleenex.
In my husband's shirt pocket and takes one out of there.
Oh, boy. Well, I had a dog. Yeah, I had a dog in today that steals toilet paper. Will take the entire roll off and eat half a roll of toilet paper. So I don't know why dogs like to eat paper like this. I think for some dogs, it's because we've taught them that it is something that may get them attention. You put your Kleenex down, they find something, maybe it smells because you used it to wipe your face or something like that, and they pick it up and you go, oh, you got to drop that Kleenex. They've just now got attention, and it's become a hot ticket item that I'm going to now steal Kleenex because I may get, some attention from the owner. I may get a treat to be able to have me drop the Kleenex. Is it going to hurt them? Probably not, okay?
No, probably
but
pass.
if it's going to be a lot of Kleenex, then you've got problems.
Boy, dogs are smart.
They are.
Smart or dumb, I don't know. My dog eats too many things. I'll tell you that. Let's go to Denny in Mount Horeb. Denny, what do you have on your mind tonight?
Hi, Sandy. Thanks for taking my call.
No problem.
I have an indoor-outdoor cat that got injured here about 3 weeks ago in a fire. The bottom of her feet were severely injured.
Oh, boy.
Anyhow, she's back on her feet. She's doing fine. She's back indoors, outdoors again. The only trouble I'm having with her now is she doesn't want to use the litter box.
Oh, boy. And that's got to be painful for her, and it may depend on the type of litter that you're using as well. Coarse litter, like regular clay litter, may just be too sensitive on those feet because, if she's burned her feet, there's probably a lot of raw nerve endings there. Couple of things that you may want to try. If you're not using the scoopable, soft, sandy litter, by all means, try switching to that. It would be like the difference between walking on the shore of Lake Superior with rocks or down in the Bahamas on, nice soft sand. You may also want to try shredded newspaper. That's something that we'll often use, and you can just put paper through a paper shredder, and a lot of cats will use that as well, and that may be a little more comfortable on her feet. But hopefully this will pass because, boy, having a cat that's not using the litter box, it's not going to be very nice, especially come winter, and they're going to be inside all the time.
Those pads can be so sensitive.
He's already been through such an ordeal, too.
I know.
Let's go to Woody with a question about allergies. Woody, is that right?
That's correct. My dog's been chewing his feet quite a bit the last few days and got some watery eyes the last couple of days also. I wonder if they're bad this time of year. Yeah,
allergies are really bad, and we've seen lots and lots of dogs and cats showing signs of allergies. And the typical symptoms that we see are, for dogs, it's their skin. It's usually their ears, their feet are the hot spots, and then as they itch and lick and traumatize their skin, they can get secondary infections, yeast and bacterial infections that can add to the itch, and it just keeps getting worse and worse and worse. So a couple things you may want to do is take your dog into your veterinarian to see, is there something there that is causing the dog to itch, like a secondary infection? Get that treated. And then new things that are coming out there's a lot of new things coming out on the market for dealing with allergies. There's a drug called Apoquil, which has been in short supply, but is now, we're getting more and more of it on the market, and it's wonderful. It's a once-a-day medication, very safe to use. And there's a new monthly injection that's going to be on the market soon that's a type of immune therapy that seems to be looking like it's going to be very promising.
Are over-the-counter things for if you need to remedy quickly?
Benadryl may be helpful, but it's usually not very helpful. Yeah, you can try it. It's not going to hurt them.
If you're on the line, stay on the line. We're going to take a quick break, and then Sandi will be right back to take more of your calls. Back now with more calls for Sandi Sawchuck. Let's go to Meri from Oxford. Hi, Meri. What's your question?
Hi. Her mother cat had kittens, and they're about four and a half weeks old. And one of the kittens hasn't lost his cord yet.
Is there any concern there?
No, there probably is not any concern. I would just, if the skin around where that umbilical cord is looks normal, it's not inflamed, it's not bulging, just leave it. It will probably come off. I'm surprised mom hasn't groomed it off, because usually moms are such avid groomers that gets knocked off very early, because that's how kittens eliminate, is mom grooms their belly, and that stimulates them to go to the bathroom. So usually the umbilical cord comes off when they're in the middle of doing that too. So.
All right. Got time for maybe one more. Let's go to Dennis in Beaver Dam. Hi, Dennis.
How you doing?
Good. How are you? What's on your mind?
Pretty good. My question is, I got an 8-year-old giant schnauzer. My vet from town just referred me up to Appleton. We did a biopsy on him a week ago yesterday. Results came back yesterday. He's got a low grade, they said, fibrosarcoma on his muzzle. Now, they told me that they felt confident that they could remove it beyond the margins
and that's
of the tumor itself.
Yeah. Carcinomas.
But they didn't know what else they could do for it.
Okay.
So I'm going to be coming down to UW.
Perfect.
On Wednesday.
Dennis, we're running out of time. Unfortunately, can you stay on the line? We're going to have Sandy go into the newsroom and speak to you personally.
All right.
Sorry about that. Sorry. Thanks, Sandy.
You're welcome.
Don't hang up, Dennis. Thanks for watching, everybody.